Jared ONYANCHA is a COVID-19 survivor. He works as a guard in a quarantine center in Nairobi. He says he was infected there in March and after about a month was discharged from hospital. His employer paid the bill of $400. He tells us his biggest problem is the stigma surrounding infection.
People are afraid of me at work. I can't even get close to anyone. They shun me and say I'm coronavirus. Even at home, people don't want to associate with me. I feel lonely and quite sad sometimes.
The woman who recorded this video for Al Jazeera remains in quarantine after recently returning from China. She says she didn't expect the poor sanitary conditions in the Kenyan government's quarantine center or being forced to pay for her stay, despite the government recently agreeing to cover all expenses. Some people in mandatory quarantine have attempted to escape, and several others have sued the government for violating their rights.
We have not been given masks, no gloves, So the issue of quarantine centers being breeding grounds, it is very high likely that you can come when you're not sick and you get infected.
Government officials say they are addressing the complaints, but blame some Kenyans for not taking social distancing measures seriously, as the number of people infected continues to rise and spread within communities. That's caused drastic measures to be enforced, including banning travel in and out of Nairobi, as well as some counties on the coast. This is a police barrier on the edge of one of the most affected neighborhoods in the city. People are not allowed to go in or leave the area, which is a major trading hub. Mass testing for COVID-19 is also going on. But many Kenyans are reluctant to get tested. Some say they're afraid they will be forced into quarantine. Health experts are concerned that the government emergency response strategy may fail to flatten the curve.
You militarize or you police a public health issue, then you'll expect that people will find ways of not adhering or running away. If you're expecting people to adhere to those things, you need to approach it in a different way. And this way is not to be hard on people, is not to militarize, is to have somebody take people through, slowly explain, have people understand.
Back at ONYANCHA's home, he says he's lucky to be alive and is ready to return to work. He also hopes that his neighbors, friends and colleagues will soon stop seeing him as a threat to their health. Catherine Soy, Al Jazeera, Nairobi, Kenya.